So our next presentation is going to be from Andre, who's joining us. I can see your cameras come on there, Andre. Excellent. So I'm going to hand straight over to you, and yeah, off you go.
Sure. Thank you, Mark, for the very kind introduction and also for the opportunity to speak to everyone today. Good afternoon, everyone. My name is Andre Skepple. I am the founder and CEO of a really exciting but necessary company that I like to call FullSpektrum. And in this presentation today, I will essentially be just having pretty much a rant for 15 minutes to talk about digital transformation and how essentially we look to use technology, use AI, data as a way to not only to improve elements of neurodiversity and inclusion within the education system, but also show you our vision in terms of how we want to transform the curriculum that brings better inclusivity, equity and opportunities for those that are long left behind. And so what I'm going to do, I'm going to just quickly share my screen. And then I'm going to take you through a number of slides in this presentation. I'm going to go through the whole thing because I don't think we've got the time to do that. But we essentially will use this as a way to engage in the conversation. So the title of my presentation today is pretty much, eradicating barriers and improving outcomes. These are the things that we look to do in FullSpektrum, and this essentially is the philosophy that we look to invoke across the entire curriculum. One of the key things that we need to do as educators is to ensure that we have the right tools, the right support, the right resources in general to give our students the best opportunities in life throughout their curriculum journey. But the unfortunate thing is that how the education system currently is enabled, is functioned, is designed, doesn't necessarily include the neurodivergent. In fact, the whole term neurodiversity is a very relatively new term that we're using, not just in the schools, but in society today, where we're starting to really understand that no one person thinks one way. I'm dyspraxic and dyslexic. I only found out I was dyspraxic and dyslexic when I was 21. After 5 years of fighting the LA and fighting my colleges and trying to find out why is it that someone who is black, who is from, a background of work, living in a council estate with a mum on benefits and essentially in an environment that is commonly known to provide less than positive outcomes for people like me. But I was one of those children that did well in primary school, shown in that type of phase. Went in secondary school, did well, was expected to go and study medicine at Ruskin University. Henceforth, I went to one of the top 6 colleges in London. And going into that college itself, I ended up with only 1 AS level, despite me entering 4. Why that happened? It wasn't because of the want of trying, it was because there was something inside the institution of learning that wasn't prepared for me to then go with a secondary school where the whole environment is quite immersive based on the knowledge and experience that educators like yourself have with your students, with that relationship where the teacher directs learning to you. But then when you step into sixth form and step into further and higher education itself, that paradigm shifts from being teacher directed to being student-centered. What skills are we giving to our children in terms of centering their learning on the field of study rather than being directed by a teacher? Because as educators, we're there to provide knowledge, but not to essentially feed them with it. It's just to show them the pathways of learning and getting through their syllabuses and their curriculums in a sufficient and manageable way. But then with children, particularly those who are neurodivergent, those with autism, ADHD, dyslexia, there's a shameless plug, a full spectrum of different elements of neurodiversity that we're only starting to understand. And with the SEND Green paper that was published in April, it's now commonly known that this is a major issue that is impacting on all schools across the curriculum. And it's something that the DfE needs to make those changes with, henceforth Green paper, but with no actual solutions as to how we're doing it. And I am in a position that can say that because I've been involved in these conversations. I've spoken to DfE. I'm involved in a number of SEND panels with the DfE in communications. And I can honestly say there isn't really much of a solution that they've got. So this is why I created this company. I created FullSpektrum because I was frustrated. I was frustrated in terms of looking at my background where, you know, what if I had an early diagnosis of my dyspraxia and dyslexia? If I had an early diagnosis of dyspraxia and dyslexia, my teachers would have known how to direct learning in a particular way. I would have access to certain resources and certain support that would have given me all the tools and resources to maximize my curriculum outcomes based on the hurdles that are pretty much known to how my psychology is mapped and wired. But then also, we cannot expect our community of educators to all know how to identify a child with SEND or to know how to work with them. And I know that there's a conversation to train all teachers across the curriculum in the sense so they become much more functional and inclusive into their own curriculum itself. But let's be real. Are we really going to allow ourselves to have more time to, you know what I mean, forcefully know how to manage SEND, how to identify different types of neurodivergences and so on and so forth? And therefore, is it a case of in particular box in university, we're saying that there's a course you need to learn it, but application of that still, along with everything else, the plethora of different administrative tasks and responsibilities that we have as educators in the classroom that we need to do. So we saw it as, it's nice to know, but what if we could build tools? What if we could build a platform that actually is specialized in working within the SEND and inclusion element of the curriculum? What if we had a platform that could give us the insight into what's the neurodivergence quota in our classrooms, so we know in terms of the type of students we're dealing with? What if we had a platform that could quite literally personalize the curriculum based on each individual child's needs, outcomes, personalities, the way their minds are wired, the way their interests are? I can go on with this. An individualized curriculum, we've been talking about that for a number of years, and there's been attempts. But what we have here, and this is not a sales presentation, this is literally just insight into what we're doing, but we do truly believe that we might have the solution towards it. So I'll proceed. So let me give you a bit of background of the company. So just a bit about us. We like to call ourselves change makers in EdTech and service transformation. Our solutions are not just developed for schools, but also developed for local authorities, for clinical working groups, for various agencies in the public and private sector, and also designed for government, and to really give everyone not just the tools to make things better, but to create an ecosystem where everyone, including and most importantly the parents and the child, are all interconnected into the right insights that are required to not only personalize curriculum, but to give each child and each person the tools and the essential frameworks of having a fulfilling and fruitful life. We're dedicated to delivering better value in the improvement of outcomes and also to provide that social impact. So we're very much an outcomes focused. We develop anything that we need to do to provide outcomes to the individual or to the entire community or to the institution, so on and so forth. And therefore our speciality is in support intelligence. So this is a concept that I created, where if we want to support someone in education, health and social care, we need to have the right information, the right insight, the right strategies, the right tools to collaborate and communicate, we need the right intelligence. And so we're building support intelligence as a platform, as an initiative for SEND and inclusion. So let's go into a bit of the problem and unpack it a bit more. So there's a lack of collaboration across agencies that fall within the remit of education, health and social care. This is something that we will experience ourselves as educators. This is very much known, and now it's starting to become a part of the national dialogue and has now hit government. One of the key issues, and using my story as an example of this, is that SEND is not identified early enough. We haven't got a protocol or a framework or the tools or the resources that allow us as educators to understand in terms of how children in our ecosystem or in our classroom or curriculum have certain types of issues in their learning that need to be intervened. We only intervene once something happens. We're very much reactive to the problem, not proactive. And that lack of proactivity is because there's a lack of insight. I'll hold that thought. Next part, inefficient service processes in many areas. It's too policy driven, too process focused is not outcomes focused. And so because of all these different process channels and policies and everything that's managed in a regulatory type of standpoint, you've got education going one pathway, healthcare going a separate pathway, and then social care going another pathway. They're in separate silo channels. It's disjointed, it's not integrated, it's not fit for purpose. That's not my words. Those are the words of Amanda Spillman, the chief inspector for Ofsted. So we know this. This has now been known for about 2 years, and the Green Paper's fund everything up. And then in addition to that, there's a lot of services that are non-compliant. I'm very sure as educators, you've probably heard from parents that with a child with their educational and care plan, they find the LA to get the right provisions, the right funding banding, or even to get the EHC as a total. And a lot of this is because the type of assessments that are performed on children, most of them are quite poor quality. They'll be diagnosed for one thing, but then there's a plethora of other areas that haven't been assessed that should be supported. So why are we not getting this, not just value for money for everyone, but the value of outcome? We're not hitting these areas. The curriculum itself might be a controversial term, but I'm going to say it. The curriculum is failing a lot of our children. And then when you take intersectionalities into play, for children from Black or minority ethnic backgrounds, those from a lower socioeconomic background, those that don't speak English as a mother tongue, and so on and so forth. All these intersectionalities basically are there as a proven mechanism to get the outcomes lower and lower and lower. How can you expect a parent who's on benefits to pay £1,500 to get their child assessed for autism in the private sector because they're waiting for an assessment to be performed by CAMS, and they're urgent, that they're dying for their child to get the right support because they could be suicidal, there could be so much other elements of support that they need that's not been identified. The system's not working. I got fed up with it. So I sat down and actually designed a framework, and the framework itself requires digital transformation. And this is where I coined the term aims. It's an aim for us, it's an aim for us as educators, it's an aim for us as a company, it's an aim for the entire SEND community, the ecosystem, to achieve what I like to call elements of reform and transformation. Any type of system that supports children who are neurodivergent or is there to improve our SEND and inclusion frameworks, it needs to be accurate. We can't have plans that have incorrect information about the child. I've seen EHC plans that were meant to be drafted for a boy, and in the plan itself, it says as a girl. I've seen plans that have been drafted for a child with autism, but then the needs are not being correctly identified. I've seen assessments that misdiagnose, and so on and so forth. The situation, because it's still paper-based, it's still very much antiquated, accuracy is very much an issue within that. So it needs to be accurate. The second point is it needs to be inclusive. Inclusivity can only be determined based on the identification of the divergence that's out there. But that's not the whole story. And I'm talking as a Black man. We can't talk about diversity and inclusion if we don't include the concept of equity. I'll give you, I'll try and explain an example of this. Imagine you have a fence. I'm about 5'11". I have someone next to me that's 5'4" on my right hand side. I have someone next to me on my left hand side that's 6'5", and then there's someone else down there that could be 5'2". The fence itself is about 6 foot. We're all standing on a level surface. You've got the person to the left who's 6'5", can see everything, has got full view of what's going on, has no issues. You've got me being 5'11". If I tiptoe, I might be able to peek through. So I can work hard, I can put in a bit of effort to see. You've got a person next to me with 5'4" that couldn't see anything and is constantly speaking to me, saying, "What's happening, Andre? I can't quite see. Could you give me a heads up?" And you've got the one that's 5'2", you know, damn, what's going on? So how do we solve this issue? So if we're talking about diversity and inclusion, what it means is we are all here, but we all can't see. We've included everyone because we've got different people, different sizes, different heights. We've got the whole element of the fence, but we still can't see. The equity part involves the assessment and identification of the differences that are out there. So when we're talking about in terms of neurodiversity, we need to have the right resources and tools to identify the neurodivergence that is there. Not just to put people in categories, and therefore you're building barriers, because you're saying that if you're dyslexic, then you've got issues with reading or spelling, so you can't do this. Or if you're autistic, there might be some behavioural disorders that you can't do this, you can't focus on this. If you've got dyscalculia, you can't be an accountant, you can't manage in terms of any type of mathematical equations or work in an industry that requires numeracy as a key skill, and so on and so forth. I've been told this, been told many times you can't do. It's not that you can't do, it's about how do I configure it or personalize it to you. That's the equity element. So let's go back to this whole, illustration of the 4 men in different heights and the fence. So you've got the guy to my left, 6'5", he's good. That is what you call neurotypical. He's a typical height. This is the setting that's there. You're typically suited to see what's happening on the side of the fence. You've got me. And my height, you could be borderline neurotypical. There's a bit of divergence there. So I tell you what we're going to do, for you to see the same amount as the guy next to me, 6'5", 5'11", let's give you a platform that gives you another 6 inches to see exactly what the guy to the left is seeing. So you got to the guy to my right. He's 5'4". He's a good 1 foot 1 inch shorter than the guy to 6'5". So let's put him, now we've identified that difference, let's give him another platform. That platform is 1 foot 1 inch. He's gonna stand at the same level as me and as the gentleman to the left. And then you've got the 5'2" lad. More than a foot. So let's put a platform. We're all at the equal height, but different levels of support. That's equity. And that's where inclusions come. So the fact that we're not doing any equity-based inclusion is because one of the key issues we're not doing is that we're not measuring it. So you need to have a system that can measure, that can not just qualify whether if it's a yes or no, it's I can help you, I can't help you, or you're doing good, you're doing bad. It needs to be qualitative and quantitative. It needs to be, I need to understand how much degree are you, how autistic are you in a very loose context. What is the degree of need you need? Because if I put you in this category, it means you can't do this. No, it means that there's a multitude of things. So for example, for me, I'm dyspraxic and dyslexic. I'm partially dyslexic, but I'm severely dyspraxic. There's a spectrum. And there's going to be other people in neurodiversity that have, different flavors of neurodivergence, of different types of categories and so forth, that can be measured and monitored, and therefore we can configure and customize the right type of critical setting to support them. So we need to measure it to make it more inclusive, to make it more accurate. We also need to measure it so we can actually have understanding of whether the impact or the outcomes are being hit. One of the biggest issues with education and care plans at the moment in local authorities and in schools is that once you do your annual review, if there's no information that determines whether if the child is performing well in their curriculum, or if there's no information in terms of the outcomes being met or the engagement's increased or anything, any type of indicator that portrays that this plan is actually fulfilling its purpose, what happens? I can tell you, in most cases, nothing. The same £6,000 or £10,000 or £25,000, or in some cases, £120,000 that's invested by the public purse into that plan just concurs over because it's inconclusive, so you just carry on. And what happens next time there's nothing to measure on? How can we configure things? How can we get better value for what we're doing, in addition to having that individual and societal impact that we are dedicated to provide as educators? We haven't got the ability to measure it. So measuring our impact, measuring our curriculum, measuring our ability to work with young people is essential in the whole elements of SEND reform. And then you've got the final part, and this is a very critical element, because a lot of people in SEND, a lot of people in curriculum in total all know that funding is very limited, it's sparse. I mean, hell, today, as far as I know, there's hardly any ministers of education. That does show where priorities are. So the fact that there's limited funding means that, you know, okay, there's no funding. So all the things we need to do, these systems we need, these additional support elements we need, these TAs we need, these LSAs we need, this new school we need, these buses to transport these children that are outside the provision type of element, all those things there. So that means we're stupid, right? We can't do anything. No. We work with what we've got and we make the most out of it. But again, it's not a thing where I can't tell you guys educators say work what you've got. You've got to make it sustainable. So the sustainability element of it is not to say we've got to be frugal and efficient with our funding. It's about being creative, about being innovative with what we've got. And not just to make the most of it so that we can save money, but make the most of it so that it can impact on more children. I'll give you some figures. The last census stated that there's approximately 1.45 million children across England that have a known special educational need, but only 450,000 of them have an education and healthcare plan. That's a shortfall of about 1 million children that could or even should get additional support from the government, from the local authority. Why is that? Most cases because the banding that's out there for children limits them. And those bandings are very much not only means tested, but they're also limited based on funding, because I've seen it. Like I said, I went for the equivalent of a ESC plan, I went for a SEND statement. They wouldn't give me a SEND statement for years. Went to university, applied, said I got learning disability, had an assessment. Oh, went through the DSA, you can have X, Y, and Z, blah, 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 blah. What's the difference? The difference is where the funding's coming from. It should not be a postcode lottery in terms of what determines what support our children have. It should be democratized for all. And the democratization element means that it needs to be sustainable. We need to have systems that don't require so much labored uses of movement within this. We need to talk about in terms of how we can make the most, how we can use technology, how we can use AI to streamline certain administrative tasks so that we don't have to employ so many people and it to be so top heavy and therefore resource intensive. We need to make it sustainable, but also we need to incentivize our greater public to get involved and to make it much more functional. You know, so I know time is running out, so I want to give you a small snippet in terms of I've been speaking about all these theories about transformation, about eradicating barriers, improving outcomes. Let me give you a small snippet of what we're going to do. This is a snippet of a solution of a framework we're looking called FullSpektrum 1, FS1, we call it Omni Support. It's about including the parent, the educator, the SENCO or the SLT members, also with local authorities, with case officers, with clinicians, to all work together in a data-driven ecosystem of support for the child that's built on identifying the needs, having dashboards and reports that can detect and diagnose or monitor in terms of how the progress is or how the outcome is being met, has a portal that communicate with all members, all agencies and stakeholders that are associated to the child and their plan, can actually use AI to prescribe referrals or interventions or provisions that's not just built on the assessment of a child, but built on those individual indicators that are measured daily. So if a child's needs change, the provision changes, the curriculum changes, it constantly moves in flux. It's not siloed, it's now blends together. Also using gamification, use gamification to maximize engagement of how we assess with the child, how we work with the child, how we teach them, how we provide information to them, and finally using all this information to personalize their curriculum and to feed it back again. And the first thing that we're building towards this is a system called FS Insight. It's the first cloud-based management information platform that's built for special needs and education. And this is what we're developing. We're looking for multi-academy trusts, local authorities, agencies that will be willing to participate in pilots and to help convert this as the right solution. And we look to start our pilots in January. And it's something that a conversation I've had with Mark and his colleagues at SENCOs within PolyMAT that I know there's interest there. So I invite anyone to get in contact with me for more information. That is my presentation, and I'd like to open up the questions. Thank you very much.
Thanks very much, Andre. Yeah, we're probably about half an hour behind schedule at the moment, so we're going to move swiftly on. But just to say, you know, as you just mentioned, we're really excited about the possibilities of working with you. And yeah, we'll be in touch very soon about that. and hopefully be piloting your product in January. So thanks again for speaking with us, Andre. I'm going to move on